Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. The body is a wonderful group of mechanisms with its own defense system. But sometimes something goes wrong with the soldiers guarding the fortress. White blood cells are an important component of the body's immune system, protecting an individual from invasion by bacteria, viruses, fungi, and other foreign substances. Leukemia is a cancer of the body's blood-forming tissues, where the white blood cells are not as effective as they should be. It's the most common type of cancer in children. White blood cells are produced in the bone marrow, lymph nodes, spleen, and thymus gland. In the studio with me is a consultant clinical haematologist at the Marigold Hospital and Critical Care Center in Lagos. An internationally certified haemato-oncologist, Dr. Yusuf Adelabu, is also founder of the White Cell Foundation. You are welcome to the show.
Thank you, Mary, for having me. It's my pleasure.
You're so welcome. So, leukemia, we want to find out how bad is this? You know, when people hear about cancer, it's like, ooh, death sentence. Does leukemia reduce the effectiveness of these white blood cells, or is it introducing a bad type of cell? What is really happening here?
Actually, the white cells are actually the cause of the leukemia itself. So leukemia is actually some white cells that actually, form rogue or become rogue.
Okay.
So it actually develops
they
from
mutate.
the white. They mutate. They actually get to change. They get not to be under the body's control, and they actually cause a lot of havoc in the body.
Why do they mutate? Why? And why are they not effective at the job anymore? At the defense, thing that they do for the body?
Okay, so in leukemias, what actually happens is that it depends on at what stage the leukemia does develop. Okay, some leukemias, which we call the acute leukemias, actually develop in immature cells, meaning that these are cells that have actually not differentiated to the mature cells, able to carry out the normal functions of a white cell.
Okay.
While in some other type of leukemia called chronic leukemias, the cells do get to mature to the mature cells, but for some reasons they are not able to perform their activities or their action functions properly. Usually, like most cancers, the cause of leukemia is not known, but it's known that leukemia is actually associated with a number of factors. Some are genetic, so some conditions like Down syndrome are associated with some type of leukemia. Some are also from environmental exposures, and this could be from chemicals or industrial waste, and the likes. Some leukemias are also caused by infection, common infection, viruses,
Really?
bacteria, and parasites, yes. So, for example, malaria infection has been associated with a type of leukemia called Burkitt's leukemia. So, really, there are several
that means
associated
anybody
factors.
can get it?
Well, not entirely true, because a number of events usually would happen that culminates in the development of leukemia. Most of these associated factors have been shown to be like the trigger effect of what actually starts the cascade of events that eventually subsequently lead to leukemia. So the thing is just there
waiting to happen, and then something just sets it off.
Okay, so the uniqueness in the bone marrow cells, the cells that actually produce the blood, is that they're actually rapidly dividing cells. So what is commonly known is that for rapidly developing dividing cells, there's a possibility that something can go wrong, at some stage in it. The body has a natural, normal mechanism to detect this error and correct it. But if there's a trigger, like any of the factors I just mentioned, if it's genetic, if it is environmental, or even if it is radiation, that can actually tip the development of the cells into a leukemic clone, and that starts the cascade of events that eventually leads to a leukemia.
But this is all about blood cells, and I know that blood cells, at some time, they die, and new ones are formed. So isn't that just a natural way of getting rid of the leukemia? Okay,
so that's peculiarity in leukemia. Okay, so the way leukemia develops, it actually develops from a single stem cell. Okay. In acute leukemias, which are leukemias that actually develop rapidly and can lead to death if not treated within weeks or months, in that the actual leukemic cell that develops is from an immature cell. Okay, so this immature cell, one of the things with the immature cells is that they have the ability to self-renew, meaning that they can multiply severally. but they don't get to mature to the adults or the mature cells that will perform the actual function itself. So in this mechanism, or by this method, they are actually completely cut off from the body's mechanism of controlling the division of these cells. So they go rogue and they keep dividing till they take over the entire marrow and the normal cells are not being able to be produced.
So they sort of just crowd out the regular cells and fill up the space.
And fill up the space and don't even get to even die. Some even live much longer because they develop some coping mechanism in order to evade all the body's mechanism to make sure that cells don't stay for much longer than they should ordinarily do.
Okay, before I begin to ask you for symptoms, there's something else about blood. You can actually remove it and put another set, some other pints of blood, right?
Yeah, sure.
Can't this be used to just get rid of the leukemia? You take out all that blood and put in just new, fresh blood.
Oh. So that's actually one of the modalities of treatment of leukemia. But it's not directly as simple as just taking out the blood and actually get it to replace it with one. But as you said, cells actually have a limited lifespan. So what you need is to actually get to have it from the factory, which is the marrow, the bone marrow where the blood cells are produced from. So one of the modalities of treatment for leukemia is stem cell transplantation. So what is done, because these leukemia cells are within the normal cells in the marrow. So adequate treatment is given, even in some instances, a very intense treatment is given to completely wipe out the marrow, then infuse a new set of stem cells. And because stem cells, by virtue of their characteristic, they are self-renewal, they have a self-renewal capability, and they can divide to virtually any type of cell in the body. So that's actually the mechanism, or what is being taken advantage of when it comes to stem cell transplantation, in which you get to wipe out the entire marrow, including the leukemic cells and the normal cells, and replace with a non-diseased stem cell that would eventually populate the blood at the end.
But you still have to pass through the door of radiation and chemotherapy, from what you're saying.
Yes.
Because the wipeout isn't just, it's not an ordinary thing, right?
Sure.
Okay, so does this set of cancers have symptoms?
Yes, there are symptoms, okay? So the symptoms of leukemia depends on which cell line is affected. More commonly, the red cells are affected, so the person
red cells are affected too?
Yes. The way they're affected is because the leukemic cells actually crowd the marrow and prevent the normal development of red cell, production of red cells. So one of the commonest symptoms of leukemia is anemia. Okay. So anemic symptoms like fatigue, shortness of breath. Okay. So if it does affect the platelets, which are the third other type of cell, because in the blood we have the white cells, we have the red cells, and the platelets. So if the platelets are also affecting their production and function, so the person can also present with bleeding, easy fatigability, and bleeding disorder or easy bruising can also develop. But because the white cells are the major cells affected, in this particular condition, so it means that the body has no defense mechanism, because the white cells are the soldiers of the body that help to prevent, fight infection when they do occur. So one of the commonest presentation of leukemia is to actually come down with infection. So there may be fever or other signs to suggest an infection in any part of the body. Though occasionally too, there could be fever even when there's no infection, because these cells are rapidly dividing and it takes a lot of metabolism in the body.
Okay, so the body gets hot.
The body gets hot.
By virtue of the activity.
Yes, and over time even there's weight loss, there could even be excessive night sweat just from the increased metabolism in the body.
Now, this leukemia, the modifications, we talk about the disposition somebody has to getting leukemia. You spoke about maybe hereditary factors, genetic factors, exposure to chemicals and all that. Some of these things are things that cannot be modified. Are there things that can be modified in a person's life that will sort of reduce his tendency to get leukemia?
Well, unfortunately, in the case of leukemia, it's not really been associated with a lot of modifiable risk factors. So most of the preventive strategies for leukemia actually stems from actually trying to avoid, things that are known to predispose to leukemia. Say, for example, excessive, exposure to radiation. Another one is actually also having to get too exposed to chemicals. It's been shown that a particular, chemical called benzene, is actually associated with development of some leukemia. So
Why would
exposure,
somebody be
reducing
exposed to benzene? Where would they find it?
well, benzene is actually in most industrial chemical, paints,
Okay.
and other industrial chemicals, even petroleum, it's also
So
involved in
people
it.
are fairly exposed to the risk factors then.
Yes,
Fairly
generally.
exposed, and everybody is fairly exposed.
Everybody is
So
at
for
risk.
once we have a cancer that does not respond to maybe a better diet or exercise or something like that.
Yeah, unfortunately, leukemia, has not been associated with, diets, or other known modifiable risk factors. Even though it's also known that other risk factors for other leukemias or other cancers can actually also predispose to leukemia.
To leukemia.
So
Okay.
say like
So
smoking.
I see the chain.
From it there and all that. Yeah.
What's the decider for you that somebody has leukemia? Because you've mentioned some symptoms, but you can't exactly go by symptoms of he's tired all the time, she's feeling weak. What's the deciding thing that makes you know that makes you say this is leukemia and no other thing?
Okay, so once a person comes with these symptoms, as you said, they're actually non-specific symptoms. There are thousands of causes of anemia and the rest of it. So one major important thing, the first step to do actually, whenever an anemia is noticed or if it's any of the symptoms that we mentioned, previously.
Weight loss would be a good one.
Unexplained
weight loss.
Unexplained weight loss. Even fever. And that's why one of the first steps is to actually have a blood count, a complete or a full blood count, which will show the hemoglobin, the packed cell volume, that's the hematocrit, the white cell count will be measured, and also the platelet count in this. So usually the machine, the automated machine that actually does the full blood count can actually flag a leukemic cells if actually present in the blood sample. So a simple blood test just to check the blood count can actually
but what
be
you're
a
actually
pointer
checking is
to
a
it.
count.
It's a
Does
count.
it go up or down?
Usually it goes up. That is, the white cell counts go up. So usually the hemoglobin is low, from the crowding out of the red cells. The same thing with the platelets. So there's low platelet count. But most times in leukemia, the white cell counts are quite high. But other times it may be
doctors have
normal.
told me that when the white cell count goes high, it could just be an indication of an infection.
Yeah, that's the commonest cause of an elevated white cell count. But one thing about the blood count is that aside from just having the total white cell counts, there are actually what we call differentials, because there are different types of white cells. You have those that actually engulf bacteria like neutrophils and the likes, and you have those that are actually part of the immune system like the lymphocytes. So a differential count, knowing which of the different type of white cells is preferentially elevated, can be a pointer to a leukemia. And I said the machine also had, because there are certain normal properties of normal blood cells, which leukemic cells are actually different. So they preset values or parameters on the machine that once it detects that this is not any of the preset parameters for normal blood cells, then it flags it. And that prompts the laboratory to actually get to look at the blood under the microscope. So a blood film is made, and the cells are actually viewed under the microscope. And usually the leukemic cells are actually detected then.
Who does this affect more, children or adults?
Because there are different types of leukemia. As I said, there are several dozens, if not even hundreds of different types of leukemia. So each specific leukemia actually has a different epidemiology, set of people that it affects. There are actually 4 major types of leukemia. So you have the acute myeloid leukemia, referred to as AML for short.
Then you have the chronic.
The chronic leukemias.
Let's quickly go on a short break. When we come back, we'll continue from there. Please stay with us. We're going on a tiny break. We'll be back after this. Welcome back. Call 0805-468-3514 if you have any questions on leukemia. And you can also tweet at CTV_Mary A. You have spoken of different types of leukemia. Some affect the adults more, some affect the children more. You spoke of the acute myeloid leukemia, chronic myeloid leukemia, Then there's the, I'm only mentioning them just so people will know that there are 4 different types. Then there's the acute, lymphoblastic leukemia. Then there's the chronic lymphotic.
Leukemia.
Lymphotic because it's an adult cell.
Yeah,
it's affecting,
it's an adult mature cell.
Okay, so I've heard of biological or immune therapy where
Yes.
you raise the immunity of the body. How effective is that as treatment?
Oh wow, very really effective really, because the long-term stay of most treatment of most cancers has been chemotherapy, and chemotherapies actually don't selectively destroy the cancerous cells; they also affect the normal cells. So immunotherapy has been one of the recent developments in the treatment of many conditions, not just only cancers. Okay, so the major thing that immunotherapy actually takes advantage of is that it's been shown that the leukemic cells actually have on their surface specific markers that can actually help the body to identify them. So this immunotherapy are actually medications that are developed to specifically target the leukemic cells such that it selectively destroys the leukemic cells and leave the normal cells
you have something that can
to.
selectively destroy leukemic cells.
Yes.
That sounds like a winner to me.
It is.
Are there any other therapies you use besides the bone marrow transplantation or the stem cell transplantation and the immune therapy? Any other ones?
Radiotherapy too is also one of the
on its own.
On its own, even though it's not common used for most of the leukemias, but some leukemias actually also require the use of radiotherapy.
So which would you rather? From what we have discussed, I'd rather the immunotherapy. But which would you rather, for your patients?
No, actually, in different type of leukemia, as I said, there are 4 major types. As you said,
so
it depends on the specific type. Acute leukemias are actually, very rapidly dividing leukemic cells. So they should be treated as soon as possible, because if left untreated, will lead to death in weeks or even months. Unlike chronic leukemias that develop less rapidly, and if untreated, can lead to death in months or years. Okay. So for acute leukemias, depending on the type, of it, because you have to aggressively, treat the acute leukemia. So usually there are actually about 3 phases in the treatment for acute leukemia. So you have the intensive phase, which is actually made with very, high potency medications, including immunotherapy and chemotherapy. Most times immunotherapy is not used alone; it's used in combination with chemotherapy. We have still not really, done completely away with chemotherapy until we have enough immunotherapy medications that can on their own, treat or cure leukemia. Then we'll still require some chemotherapy.
Because chemotherapy is destructive, in itself.
Yes, it can be quite intense.
Well, since it's the best that one has. Now, what I want to ask you now is, do these therapies represent a cure for leukemia? Are we talking about the leukemia going into remission or disappearing? Or we're just talking about managing it?
The good thing about leukemia, even though it's not a good condition to have, is that it is curable. Most leukemias are curable. Of course, one of the things that would ensure that it's curable is for it to be detected early and to have appropriate treatment for them. Say, for example, one of the chronic leukemias, chronic myeloid leukemias, is actually a very treatable condition. In fact, the current medications available for it, we have someone even that was in the clinical trial when the drug was first developed, has been living for over 25 years now.
Oh, that's
and
wonderful.
Is completely cured.
But does it have to stay on some medication for life?
So for this specific type of leukemia, in fact, currently what they're actually doing clinical trials on is actually to see if the person can be in what we call treatment-free remission. So for chronic myeloid leukemia, CML for short, usually the individual is on treatment for a number of time, and some monitoring is actually done to see that the level of the leukemic cells are actually at undetectable levels. Thereafter,
let's
the treatment
quickly take
is continued
a call before we continue on this. Hello, Sani.
Yes, ma'am.
All right. Good afternoon. What's your question?
Yes, my question is, please, I want you to differentiate between sickle cell anemia and the leukemia you're talking about. And
thank you. Go on.
Take the doctor to introduce new stem cell into an anemic somebody with this such disease. That is the anemia.
Okay, thank you, Sani. I'm not sure I understand the second one, but the first one, I think that's an excellent question. What really is the difference between sickle cell anemia and leukemia? Because they're all blood-related, bone marrow-related things.
Okay, sickle cell anemia is actually when the body does produce the red cells, the hemoglobin in the red cells are actually, a form of hemoglobin called hemoglobin S, unlike the normal hemoglobin, which is hemoglobin A. So sickle cell anemia is a genetic condition in which, it's inherited if one actually has two S genes,
Okay.
Inherited. The difference from leukemia is that you have a supposedly normal cell which has been producing normal cells all the while. And suddenly something happens and it actually starts, producing leukemic cells.
Okay.
And such is actually not inheritable as opposed to what you have in sickle cell leukemia, aside other differences between the conditions.
Okay, so we're talking about treatment, and you said it's completely curable. And we're talking about the chronic myeloid, right?
Yes, chronic myeloid leukemia.
You do the monitoring, treat, monitor, and then you leave the person, he's free.
When it gets to a particular period of time, after having to have treatment to more like have a maintenance level, just to be sure that the leukemic cells don't resurface. Now it's even been, studied that you can actually even be completely off the medication. Unlike in the acute leukemias, sorry, I didn't get to talk about the acute leukemias are actually curable from the onset.
Okay.
So there are three phases in the management or the treatment of acute leukemia. So there's, an induction of remission, meaning you give very high dose medication to ensure that you actually wipe out all the leukemic cells.
Let's quickly take this call from Abdullahi. Hello, Abdullahi. I think we've lost Abdullahi, but you can try again. Do try again. I'm concerned about something. This same acute leukemia that you're talking about, you said that these are fast dividing cells.
Yes.
And it could be life or death in just a few weeks. Now, are the symptoms strong enough, indicative enough for people to actually come to the hospital in time? It takes a very discerning person to know that this is something I should take to the hospital and not nurse at home. Is that one of the problems we are having?
That's a very good question, Mary. Definitely, that is one of the problems we are having. As we discussed earlier, the symptoms are symptoms which several other possible causes could be there. Anemia symptoms, bleeding, conditions, and the rest. So, but what is important is that whenever one actually has any of these symptoms, whether anemic symptoms or even a fever, it's important to actually go to the hospital. And part of the evaluation that will be done is to do a blood count.
Okay.
In acute leukemias, it's very, very sensitive. Just by doing a complete blood count, there would always definitely be features suggest that this is likely to be an acute leukemia.
Thank you so much, doctor, for coming to the show. A fever is not an innocent symptom.
Definitely not.
Thank you. Thank you for being with us. Thank you so much, Sani and Abdullahi, for calling in. Have a wonderful day, everybody. I am Mary Alale Yusuf.